Minister, the National Principals Forum has reported that 84% of schools have seen an increase in pupils with additional education needs in the last 4 years. But over the same period, there has just been an additional 31 frontline educational psychologists appointed to our primary schools, which is leaving a dramatic deficiency in capacity within the system.
Thank you, Minister.
Thank you, Deputy. The Department of Education's National Educational Psychological Service provides a school-based consultative psychological service in 2 ways: through the provision of an individual casework service for students and a support and development service for school staff. Educational psychological assessments are not assigned to schools. Rather, educational psychologists are assigned to schools. The NEPS casework service involves the provision of a psychological service for a student, with the psychologist working with the student, teachers and parents and other professionals if appropriate, to identify need and plan for intervention and review to support the student in school. This service can take place over an extended period of time with NEPS psychologists. This model does not operate a waiting list basis and extends to approximately 8,000 students per annum. The NEPS support and development service, reaching an estimated 25,000 teachers annually, is an applied psychological service for school staff to help them build their capability to respond to the well-being, academic, social and emotional needs of all students, and particularly those who are experiencing barriers to their well-being, learning, inclusion and participation. This model of service allows psychologists to give early attention to urgent cases and also to help many more children indirectly than can be seen individually. It also ensures that children are not referred unnecessarily for psychological intervention. The capacity of NEPS has increased significantly from its 2016 allocation of 173 whole-time equivalent psychologists. The capacity of NEPS was increased recently as part of a package of measures to support the reopening of our schools with the provision of an additional 17 psychological posts to NEPS. And that brings the overall sanctioned numbers to 221 whole-time equivalent psychologist posts. This represents by far the highest number of psychologists sanctioned for NEPS since its inception in 2000, and the capacity of NEPS, I will say, will be kept under review, and I hope to be in a position to increase this capacity in future years.
Minister, first of all, can I say I don't disagree with the model that is being used. The difficulty is that in tandem with that model of supporting schools, in order for students to access additional supports, they do require a psychological assessment. And 31 additional frontline psychologists over the last 4 years, when 84% of primary schools are stating that there has been an increase in the number of pupils presenting with additional education needs, is insufficient. And yes, it is the case that psychologists are appointed to schools, but they're allocated specific hours to those schools, and particularly schools that are not in the small school category, not in the large school category, but the medium-sized schools are squeezed. And just to give you an example of that, in one school where one educational assessment has been carried out, 6 pupils have had to go privately to get that assessment.
Thank you, Deputy. I do think it's important at this point to point out that the provision of support in schools is not dependent on a NEPS assessment or diagnosis, and I think that's very, very important. That is a new model that was introduced in 2016, and I appreciate the Deputy acknowledging the various strands of work which the NEPS psychologists are involved in, but it is very important to point out that support in a school is not dependent on the NEPS assessment or diagnosis. The SET model of resourcing, which was introduced, as I said, in 2016, is a needs-based resourcing model. Schools are provided with additional resources to support pupils with additional learning needs, care needs, or who have special educational needs from a set allocation of resources based on the school's profile. Schools then have discretion to provide additional supports for pupils based on their actual identified learning needs, as opposed to allocating set quantums of time to pupils who have been assessed as having a particular disability, with certain pupils who may not have had an assessment excluded from the provision. Children who need support can have that support provided immediately rather than having to wait for a diagnosis.
Minister,
Thank you.
Minister, just to correct the record, if a child is in need of assistive technology in order to access the curriculum fully, this would not be granted without being strongly recommended in a report, and therefore that report is essential in that particular scenario. Now, Minister, I accept the principle of what you're saying to me here, but the practical reality on the ground is very different. And, you know, I know of schools where there are very proactive teams of staff where they use all of the mechanisms that are available to them. They use all of the resources. They engage directly with the educational psychologist and exploit the model that you very well articulated here this morning. But at the end of the day, the situation is in that particular school with less than 150 pupils, 6 families have had to go in the last 12 months to get private psychological assessments at a cost of between €500 and €600. Some of them have recommended further occupational therapy assessments, which is a further cost on those families, and it should be based on need, not on the financial resources of a particular family.
Minister, to conclude.
Thank you, Deputy. I do want to acknowledge, as you have acknowledged, the excellent work that we do see on the ground in terms of our schools, in terms of our special education teachers. And again, I will say that the model as introduced in 2016 is working more effectively in that it does allow a child without a specific diagnosis to be catered for within the school environment by virtue of the hours that have been made available through the special education teacher. I will also acknowledge, Deputy, as I said at the outset, since becoming Minister, I have been very conscious of this work within our schools, the value of the work within our schools, and indeed the whole emphasis that's important in terms of well-being and inclusion in our schools. And it is for that reason that I very specifically made a determination as schools reopened and as we returned that there would be additional psychologists made available for the benefit of schools and the benefit of children in particular. And I have committed to keeping that under review, and I will absolutely continue to do that.
Thank you.